Turn to question 6. I call on the Honourable Member for Onchan, Ms Edge.
Thank you, Mr Speaker. I'd like to ask the Minister for Health and Social Care if he will make a statement on oncology services at Nobles Hospital.
And the Minister for Health and Social Care to reply.
Thank you, Mr Speaker. Oncology services both in Nobles and across the wider DHSC are currently undergoing a range of changes as we transition towards Manx care. A new cancer strategy has recently been drafted, which we aim to finalise within the department early in the new year. This new cancer strategy presents an integrated model for cancer services for the future, aiming to provide a supportive pathway for those with a suspected cancer through diagnostics, treatment, to living with and beyond cancer. The strategy will also take into account the outputs from the Transformation Pathfinder team, who have also started their process to review cancer services. Workshops, stakeholder interviews and service user involvement surveys are currently being undertaken to develop a better understanding of the patient pathways and areas for service development. There have been many challenges over recent months within cancer services, including the impact of COVID-19 and increasing number of referrals beyond the capacity in place. Patients with a diagnosed cancer have continued to receive treatment locally or with our tertiary centre partners despite the impact of COVID-19, although this may not have been within the usual cancer waiting time targets. We will continue to prioritise the diagnosis and treatment of cancer throughout Nobles Hospital, including how patients continue to be monitored throughout their pathway to ensure access to services.
Supplementary question, Ms Edge.
Thank you, Mr Speaker. I wonder if the Minister, because there was no mention of this within his statement, can the Minister confirm that we do have an oncologist on island at present to support patients? And can the Minister also confirm that access to the oncologists for patients who have a terminal diagnosis is face-to-face? Thank you, Mr Speaker.
Minister to reply.
Thank you, Mr Speaker. Obviously, it was a wide range of questions, so what I can confirm is that we do have visiting oncologists, and as far as I'm aware, it is face-to-face, but if the Honourable Member has any evidence that says that it's not, I'd be interested to hear that, because certainly from my point of view, where it's a terminal diagnosis, it should be done face-to-face.
Supplementary question, Mr Collister.
Thank you, Mr Speaker. Can I ask the Health Minister for an update with the negotiations with Clatterbridge and when the Isle of Man will actually have a signed contract in place? Thank you.
Minister to reply.
Thank you, Mr Speaker. Unfortunately, the COVID-19 did delay our negotiations with Clatterbridge. From our side, we have everything pretty much ready to go. But as you can expect, Clatterbridge itself has been rather busy over recent months, so it has been delayed. But we wish to get that back up and running as quickly as possible and to get a signed contract in place early in the new year.
Ms Edge, supplementary question.
Thank you, Mr Speaker. The Minister said there's visiting oncologists. Can the Minister circulate, if he hasn't got the information to all members, how many times the visiting oncologists have been on island and how many patients they've actually seen during that period? And I just wonder if the Minister could confirm, is there only a cancer specialist nurse dealing with a lot of these patients at the present time?
Minister to reply.
Thank you, Mr Speaker. I'll have that information circulated.
Supplementary question, Mr Collister.
Thank you, Mr Speaker. Can I just push the Minister slightly on the date in the new year? Can the Minister give reassurance that contract will be in place, say, by March next year? Because it has been ongoing for nearly 2 years, those negotiations.
Minister to reply. Thank
you, Mr Speaker. From our point of view, we want it in place for the new financial year, but obviously contracts have two parties to it, and it will depend upon capacity at Clatterbridge.
Final supplementary, Ms Edge.
Thank you, Mr Speaker. I thank the Minister for his commitments, and but we do need to reassure the Manx public that we do still have continued excellent services from Clatterbridge. So can the Minister confirm how he is ensuring that Manx patients have got the best access to fast service for cancer, please?
Minister to reply.
Thank you, Mr Speaker. I think considering the amount of pressure that has been on the oncology service this year, particularly around the COVID-19 period, when a lot of screening and a lot of cancer treatments had to be postponed because it became very quickly apparent via the issues in Italy that those with cancer had 5 times the mortality if they caught COVID-19 of an ordinary person without cancer. that I think the oncology team, both here and in Clatterbridge, have worked exceptionally hard. They've been able to provide advice and support that wouldn't necessarily normally be provided on Ireland over here. It has meant that we've had extended waiting times, but both teams are working exceptionally hard to ensure that the standard of treatment remains as excellent as it has always been.
Please like and subscribe to the Isle of Man TV channel. Thank you.